For those who just arrived, I'm Kathy Crane, and on behalf of everyone at the American Parkinson Disease Association, I want to welcome you to today's presentation, Life with PD, Coming Back from the COVID Lockdown. APDA's mission is to provide support, education, and research to help everyone impacted by PD live life to the fullest. To that end, we offer a wide array of programs, including physical and mental exercises, voice, dance, art, and our signature support groups. Right now, these are virtual programs, but they are quickly over the next few months moving to be virtual and in person. So stay connected because you'll see changes and be able to go to some support groups in person as early as July in St. Louis. When it comes to education, we offer individual presentations such as today in our annual Midwest Congress, which is in April, Dr. Gilbert's blog. We have written materials on the website and opportunities to learn about research advancements and trials you may want to investigate. So our website is chock full. We're here, you can call, you can email, we'll help you get to the information you're looking for. Today's presentation, Life with PD Coming Back from the COVID Lockdown, is sponsored by the JCA Charitable Foundation. They're fabulous partners and we're so grateful to them. Also, we're very grateful to all of you who made a donation along with your registration. Thank you for paying it forward so that we can offer quality free programming to anyone, anywhere. Thank you. Your donation really counts. It really does. Today's program requires your participation. You can ask questions through the Q&A. So please use that box and they will go directly to Dr. Gilbert. After some brief introductory comments, APDA's Chief Scientific Officer, Dr. Rebecca Gilbert, will discuss your questions with our speaker. So now I'm pleased to introduce Dr. Joel Perlmutter, the Elliott Stein Family Chair of Neurology at Washington University, APDA's Scientific Advisory Board member, and Medical Director of our chapter, the Greater St. Louis chapter. Take it away, Dr. Perlmutter.
Thank you very much, Kathy, and I really appreciate the APDA and everything that they're doing, especially the Greater St. Louis chapter for our area, but the national organization and everybody there, including Rebecca Gilbert, of course. So I'm delighted to be here. Really, this program started because I was asked to write a brief article in our local newsletter about coming back from COVID and how do we do that. And I thought this would be easier. So let's go ahead and move forward. What I want to do is give you a few introductory remarks, and then mostly really I want to answer your questions. So the other reason to do it this way rather than something written is this is such a fast moving target right now. And in fact, it turns out that that was quite prescient because there have been changes just this week. So let's start. Coming back from COVID, first of all, are we back from COVID? I think that's the very first question. And there's no question we are on our way. Why are we on our way? Because of vaccination. So the first point I want to make is, please, I plead with you, everybody needs to be vaccinated against COVID. It's very important. There's no question. These vaccines are extremely safe. The risk of the vaccination is far, far, far less than the risk of COVID. So it's really important everybody gets vaccinated. And why are we coming back? We're coming back because people are becoming vaccinated, but it's a little bit uneven. There are areas in the country where there's very high vaccination rates. And by vaccination rates, I'm talking about if you need 2 shots, both shots completed and waited sufficient time. If you need just the 1 shot from Johnson & Johnson, you have to wait a couple of weeks. That's called fully vaccinated. If you don't meet those requirements, you're not fully protected as the way those vaccinations can provide. In New York, it's almost 70% or so of people are being vaccinated. It's really amazing. And there are a number of areas where it is that way. Missouri, not so good. We're about 38% fully vaccinated throughout the state. And in fact, we have rural areas that are very much not vaccinated. So the risks of coming out remain just as much as they were before, unless you're vaccinated. If you're vaccinated, your risk is much lower. Let's make one more comment about what's different this week compared to last week. This week, we have the spread of the Delta variant. What does that mean? The virus that causes COVID, like every virus, has changes. Those are called mutations. It's natural for viruses, particularly these mRNA viruses, to change with time. Those changes can make differences in how contagious the virus is, how severely it may affect you if you get infected. So with the Delta virus, or the Delta variant, the new one that's now really in Missouri, particularly catching on, and I suspect probably over the next several weeks, it's going to be by far the predominant variant in this entire country, is 60% more contagious than the previous variant called the Alpha variant. And that's the old UK variant that had come through. So this thing is more infectious. It may make people a little bit sicker as well. That's a little less clear. But what is clear is the current vaccinations are still highly effective against this variant. So just because there are variants doesn't mean the vaccinations lose effectiveness. It's possible, but so far that hasn't been the case, particularly with this variant. So it's really important. I can't emphasize that enough. So what can you do if you're fully vaccinated now? If you're in a group and you're in your own home and you're with your own family and everybody's fully vaccinated, there's no reason for you to be masked. You can hug your grandchildren, you can hug your children, you can hug other people that are fully vaccinated in your group. Can you go out? You absolutely can go out. If you're outdoors and socially distant, 6 feet apart, you probably don't even need to be masked. If you're in a very large crowd where you don't know whether people are vaccinated or not, you're better off being masked. If you go indoors into stores, for example, I still recommend being masked. When we get higher in our vaccination rates, you can probably drop that, but we're not at that situation right now. If you're vaccinated, you are at lower risk, and we now know this, of transmitting the virus. So that means it's possible you still get an infection. It's possible you still get sick from the coronavirus. It's less likely that you would be severely sick. Those risks are much lower. It's even lower, and you do have some chance of carrying that virus and sending it to somebody else, even if you don't have any symptoms. But that chance is far, far lower than if you were not vaccinated. It's really the chance of you transmitting this virus, if you're vaccinated, is very small. But again, just to point out, the vaccinations dramatically reduce your risk. They do not make it zero. Okay? So that's the important caveat here. So are we opening up more than we had before? Absolutely. Can you feel more comfortable? Yes. Can you go to the grocery store? I would say yes, but I would wear a mask at a grocery store and keep distant appropriately, even if you're vaccinated. If you're not vaccinated, what do? You get vaccinated. And that way you can enjoy the extension into the community and help protect not just yourself, but all of those people around you. So what are the common issues about transitioning from being holed up and isolated to now going back into the community? And do you have concerns? And are you afraid? All of those are normal responses. And so it's probably reasonable to go in baby steps, whatever makes you comfortable. If you still go in a large group and you come to a group of people and people are taking off their masks, and now you're feeling pressure. Should you take off your mask? Should you keep your mask on? This is a common scenario that people face. I would say if it's a small group and you know they're all vaccinated, I think you can be comfortable taking off your mask. If you're not comfortable with that, you still want to be masked, that's okay. If you're around other people and you're not certain, absolutely certain of their status as far as vaccination, I would keep my mask on. So I think that's an important issue to keep in mind. There are lots of questions. I don't want to anticipate everybody's questions, so I'm going to go right to the question. So I'm going to bring on Dr. Rebecca Gilbert, our medical director of the National APDA, American Parkinson Disease Association. She's my partner in crime here. So she's going to direct me and feed me the questions. And then when I don't know the answer, she's going to help me.
Sounds
Rebecca.
good. All right, fantastic. So we have had a lot of questions submitted as people registered, and please, of course, feel free to enter your questions now. We have a question that Victoria just asked, and if you could address for us the long haul symptoms of COVID. So what do people need to be concerned about if they've had COVID and they think, you know, that's all done? Are there concerns having had COVID and the continued symptoms potentially?
Yes, I think the long haul symptoms of COVID are something that we're learning more and more about every day. And first of all, what that refers to is symptoms that persist, and they can persist months. I can't tell you years because we don't have that experience, but it can be, I can tell you up to a year we know already. It may persist even longer than that. And the kinds of symptoms that people can develop, they can develop difficulty with concentration. They can have ongoing fatigue. Those are the major things that people complain about, but there are other symptoms as well. And these long haul symptoms you would think would be more common after people who have serious COVID, but they also may occur even people who have mild symptoms. So COVID is nothing to be casual about. We want to avoid COVID. And so just to remind you, that's another good reason to be vaccinated. If you're vaccinated, you're far less likely to get COVID, which means you're far less likely to have long haul symptoms. This is even a greater concern to our younger people. And our younger people that are teenagers, even in early 20s, who frequently have a sense of indestructibility and don't necessarily move forward in getting vaccinated. And one reason is they tend to have less severe COVID, but they still can have long haul symptoms and be substantially impaired, potentially for the rest of their lives. So this is something we really want to avoid.
Thank you very much. That actually leads to a question that was asked during registration. What about children that are too young to get vaccinated at this point? Some of these grandchildren, for example, they're less than 12. How do I keep them safe?
Right, really good question. So we know, first of all, they can be infected. They're much less likely to have disease or manifestations. They're much less likely to have severe disease, but they can catch the virus and they can spread the virus. That's absolutely true. So it is of concern. But what we need to do is, for example, that raises the question about schools. Young children in schools where they're around other kids that are not well vaccinated. How do we make sense of this and how is this safe? Well, it turns out our data so far is there's really very, very little spread in schools for young children. That's a relatively uncommon scenario. The bigger risk in schools was really from the adult teachers before we had vaccinations. And now if the teachers are vaccinated, the chances of kids picking up COVID at school is really smaller. If you have a child that's exposed to adults that are not vaccinated, that child can carry COVID. There's no question. But the way you protect yourself is to be vaccinated. And then the chance of getting any symptoms or COVID from a very small grandchild really are quite small. And so quite frankly, you can still hug your grandchildren at this point. And that's the important thing. And that is an important thing. And I will tell you very specifically, I'm about to have a grandchild. And so I plan to hug that grandchild. And she will not be vaccinated for a long time, I suspect.
Fantastic. Congratulations. So we'll follow Dr. Perlmutter's lead on that. We have a great question from Doug, which is something that I think has been on people's minds for the last 15 months. When you wear a mask, are you preventing yourself from getting COVID, or are you preventing others from getting COVID using that mask? What does the mask actually do?
Yeah, so there's really very reasonable data on this. And this has been the source of controversy. The reality is, or the best data tells us, that you are protecting the people around you. That's what you're most effective at doing with a mask. However, the mask also protects you to a greater degree. And it depends what kind of mask and how close you are to other people. So it works both ways, but probably the most important thing you're doing is you're protecting everybody else. And especially prior to vaccination, this was a major way of reducing spread of COVID. So there's two functions. Bigger one, protect everybody and your loved ones around you. Secondarily, protect yourself.
Very good. So we have a number of questions that came in during registration about how safe it is to engage in the medical community. So for example, somebody was interested in getting deep brain stimulation surgery. Is it safe at this point to go to the hospital and get that type of surgery in this era?
So let me reach back to the before vaccination stage and tell you about some interesting data. So at that time, because there were a lot of people in the hospital with COVID, the community was afraid to come to the hospital for treatment. And what that did is there was a lot more deaths from strokes and heart attacks because people were afraid to come to the hospital. I can tell you, working in a hospital, that the safety precautions and PPE, personal protective equipment, as we call it, masks and hand washing and all that stuff, a hospital is probably the safest place you can be, far safer than the grocery store. Because at the grocery store, there's not the same kind of control that we have in the hospital. So you are absolutely safe going to the hospital if you have any medical emergency. And now in the vaccination era, I can tell you, for example, in our hospital system, as of the next couple of weeks, it's mandated that every faculty and staff and worker in the hospital and our university must be vaccinated. So you are probably coming into the safest environment you can be. So elective surgeries like DBS, deep brain stimulation, absolutely okay and extremely safe to pursue at this point. For a while, we dramatically cut down elective surgeries, in fact, even stopped them. Hospitals were very afraid of their bottom line because they weren't doing this stuff that generates money, but also helps people, you know. But now we're back to that point where we can do elective procedures because we know we can do them safely. Transmission within the hospital is almost unheard of.
Great, very reassuring. Thank you very much. We have a great question from Jen, which is, what is your vaccination threshold where you would feel comfortable going maskless in a crowded place, indoors or outdoors? What would that number be for you?
Well, I'm not really the epidemiologic virology expert, but you know, my feeling is we need to be above 70%, and I would be very comfortable at 80, 85%. And more importantly, I'd be comfortable if we were at that and we were not seeing any problems in the community with COVID going around it. And we have those data day to day. And so that will tell us, I mean, we can predict what level of vaccination, the so-called herd immunity we need to be to reduce our transmission. And that's usually in the 70 to 85% range. I like to be on the little higher side because I'm a little bit more careful. But what really tells us is what's happening in the community infections. And part of the reason for that is if we as a country or a state or a community have 80%, that doesn't necessarily mean that 80% is equally distributed across that community. There could be pockets where it's 10%, and you could still get COVID going rampant within those pockets. And so that's why it's a little bit of a sketchy thing to say, but in general, 70 to 80% is the number we're looking for.
Very good. And so it's going to obviously vary across different communities, but that's sort of our goal across the United States. So that's great. We have a question from Bill, which sort of harkens back to our understanding about COVID and Parkinson's in general. Our two questions: are people with Parkinson's more likely to get COVID? And if somebody does get COVID with Parkinson's, is the severity going to be higher? And I think it's important, we addressed this last time we had a conversation about COVID, but I think it's really important to address it again, especially now when people may be weighing their thoughts about vaccination.
Sure. Well, I don't know that people with Parkinson's disease are at any greater risk of contracting COVID than anybody else. The question of whether they are more likely to have more severe disease because they have Parkinson's it's kind of an interesting story, and there's been different publications actually about this. And in general, the answer is yes, they may have more severe disease, but it's not necessarily just because they have Parkinson's. It's because they may have other conditions, what we call comorbid conditions, that also increases their risk. Certainly, if you have Parkinson's and you're having a lot of swallowing problems and you're liable to get pneumonia because food goes down the wrong way and it gets into your lungs, and that can cause a chemical reaction in your lungs, having that kind of problem is that the lungs are an area that COVID can attack. Interestingly enough, the Delta variant is a little less likely on the lungs, more likely in other parts of the body, but still can hit the lungs. So that may make the risk higher for having more severe symptoms from COVID because of Parkinson's in that case. But I don't know that there's a lot of data supporting that. It just makes sense to me. But in general, people with Parkinson's, we tend to be older people who have other things going on, and that all those things add up and makes the risk higher.
Right. So once again, get yourself vaccinated, and
right,
especially if you have Parkinson's. Fantastic. So we have a couple of questions where children of people who have Parkinson's disease ask about their loved one, their parent, that there have been some debilitation, some slowing down of their parent during the lockdown, during all those months where they were inside. What are your suggestions about getting somebody back on track after they have experienced a decrease in their activity?
Isolation that we've been through and reduced activity takes its toll on everybody. Takes its toll on people with Parkinson's. It takes its toll on people who are older, and you can be young with Parkinson's too. But all of these things contribute to deconditioning our body physically, and you know what? Deconditioning our mind mentally as well. And and deconditioning our spirit because of the loss of connections with other people. Now here, in some cases, the internet has helped bring people together, but absolutely a sense of isolation. And I've seen people have substantial reduction in quality of life and ability to do things because of this isolation. So what do we need to do to combat this as we now return towards the new normal? Well, I think like an exercise program, every incremental steps are important. I don't think try to jump into the full exercise program. You build it up gradually. So go out on some, if I were a Star Trek fan, I would say away missions, but go out on some trips into the community. Don't make them too long. Don't make them too taxing, but push yourself a little bit. Not too much. You don't want to overdo it. So you're going to build up, go to exercise classes, participate in them. You may not be able to do the whole thing from the beginning. Do what you can and then build it up with time. Have patience with yourself and also have patience with your parents and family members that have Parkinson's. Let them build up, just like anybody coming back from any period of either illness or isolation or lack of activity. That's physical. The same is really true mentally and connecting with people. It may be baby steps when you're going to see family and you have, a holiday meeting, gathering. You may want to start on an in-between size, not the full thing, just so your comfort level is increased and you feel comfortable around other people. Take it gradually. There's no reason to jump in. You don't have to go into the deep end before you can swim a little bit.
Right, and that also helps with people who are asking about the anxiety that comes with returning to previous activities. So there's really two elements. One is people don't feel physically fit, but also people feel anxious. And I think that approach is good for both.
And it's also important to share those feelings with those around you so they understand. They don't think you're just trying to stay isolated or you're not connecting. Just say, listen, I'm a little concerned about this right now. I need to step into this slowly. Share your concerns. I'm a little anxious about going. Let's take it one step at a time.
Great, thank you. So we have a question here from one of our anonymous attendees, which definitely addresses some of the things that you've already talked about. And this person is saying, why I hate masks, I can't breathe in them. I feel like I should be rewarded for having gotten the vaccine, which I think the person is saying that I don't need to wear a mask anymore. What are your thoughts on that? So if you have been vaccinated, you are in a situation where maybe other people are not vaccinated, but you are, and you would like to go into that environment and not wear a mask. What are your thoughts on that?
Okay, here we go. So my response is going to be nuanced, and I'll explain what I mean by that. So if you're one of those people who really wants to shed the mask, or you're mask hesitant, as we would say, but you're vaccinated, good step. That's your first strong step. And you want to be around a lot of people and you want to not wear a mask, I said, okay, if you're outside. And so what I mean by that, that there's good air circulation, your risk is really substantially lower. Remember, an exposure to COVID is less than 6 feet away for 15 minutes or more. Really, casual exposures aren't even considered a contact. So if you're outside and you're physically distanced, even if there's a lot of people, that's probably okay. If you're going to be inside and there's 150 people and it's a small room and it's feeling warm because the circulation isn't so great and there are people who are not vaccinated, I would say it's not a good idea. I would feel more comfortable myself and my patients. I would recommend stay masked under those circumstances. Your risk is lower if you're unmasked because you're vaccinated, but your risk isn't zero. And, when we say these vaccines, which are amazing, the Moderna and Pfizer, et cetera, they're, in the range of 90% effective. That's not 100%. That's 90% effective. It's far less risky that you're going to die from COVID if you get it. It's far less risky that you're going to be in the hospital from COVID, but it's not impossible. And so, I would live with a mask if you want to be under those circumstances, because that way you'll live with it.
Okay, great. Thank you very much for that. And this anonymous attendee asked a related question, which is, so I'm in a situation where no one is wearing a mask. The mask mandate seems to have completely disappeared. Is there a way to politely engage with other people, asking them to put on a mask in certain situations? How would you deal with that social interaction around masks?
Okay, so the key part of the way Rebecca posed that question that gives me the out is she asked, how would I respond? So this response is really dependent upon how comfortable you are as an individual. So I personally would ask people, can you please put on a mask? There is a huge peer pressure when you go into a group and nobody's wearing a mask, and I recognize that. So again, I've been in such a situation, And I've been into a room inside, or I go into a store, nobody's wearing a mask. I keep my mask on because I don't know who those people are and I don't know their status. So that's my choice. If I'm outside, I might take my mask off and feel comfortable with that, as long as I'm not standing shoulder to shoulder with somebody for a long period of time, or they're not coughing on me. It's really safe. I mean, I think that's quite reasonable. Inside, under those circumstances, we talked earlier, who does the mask protect, other people or me? Well, it does protect me to some degree, and I'm going to continue to do that. And it protects me from spreading it to other people, even though my risk is lower. Why take that unnecessary risk? And I have to be more careful because I'm in the healthcare business, so that you're safe when you come to the hospital and see the doctor. So those are the reasons I'm particularly careful about it. And I might be a little bit more aggressive than some of you as well under those circumstances. So it really, to protect yourself, if you don't know and you're in closed space, wear a mask.
Okay. We have a question from Victoria. I saw my moving disorder physician this week. I'm not doing well, I'm doing much worse than before, but my doctor says that Parkinson's disease does not change from being slowly progressive to fast progression. So that couldn't be what's happening. Can you comment on what Victoria is experiencing?
No, not really, but I can give you a sense of it. So it's hard to know without more specific details, but let me give you some general points. So yes, it is true that Parkinson's tends to be slowly progressive and not have sudden exacerbations, with one major exception, and that is any intercurrent illness. So if you have COVID, if you have a broken leg, if you have bad constipation, if you have a bladder infection, any of those things can make the symptoms of Parkinson's suddenly much worse. Now, that doesn't mean your disease has progressed faster. It means you're experiencing the symptoms more severely. And usually after treatment of that underlying or that exacerbating condition, like a bladder infection, with time, you will recover back to your baseline. Now, that recovery, and this is a common question I get from doctors, all right? So I treated their bladder infection and they're not infected, and it's 2 days later, they're not completely normal. No, it takes some time to recover from an illness. Just like if somebody's in the hospital, I tell them it's usually 3 days out of the hospital for every day in the hospital for a reasonable recovery. And that's a generalization. So the reasons for sudden change need to be explored. That's my bottom line. It could be an indolent, sudden bladder infection or pneumonia or any of those other things. The other thing it could be, in these circumstances, being isolated, it could be depression, and a sense of isolation. Those stresses is not just a physical stress, it can be a mental stress, and those are very real manifestations like anything else and need to be addressed. And that's something that you should also discuss with your doctor, because I can't necessarily fix your broken arm yourself, and you can't necessarily fix your depression yourself. They're both real diseases that need to be addressed.
Thank you. We have a couple of questions around various activities that are restarting. And what would you addressed how you would engage with other people, continue to wear a mask inside if you are in close quarters, etc. Would you say that that is the case for an exercise group, a support group? How would you sort of rank those two activities? Which would be safer? Would you engage in both? Would you do one before the other, an exercise group versus a support group?
Okay, so I've addressed this. This question I've heard lots of times. Okay, so this is important. So the first thing is on an exercise group. An exercise group, if it's outside, zero issue. If it's inside and there's plenty of space, I'm more comfortable if everybody's vaccinated in the exercise group to be without a mask. I think the exercise group, you encourage masking. If you're not sure the status of everybody with masking, wear a mask, but do it. I think that's probably okay. Support group is the same kind of thing. Usually they're not 50 people. It's usually 10 or 15 people. And you can go, and it's usually inside, because that's the nature of those kinds of things, depending upon the weather, especially as it gets hot now, it's more comfortable inside. If that's the case, you can look around and ask, is everybody vaccinated? You know, if everybody's vaccinated in your support group and you feel comfortable taking off your mask, I'm perfectly fine with that. If there are people who are not vaccinated in that support group and you're inside in a relatively small space, I would keep masked. Both activities today are perfectly reasonable. And hopefully our Parkinson's community is vaccinated.
Excellent. Okay, thank you. So we have a great question from Leslie. If you are around somebody who has had COVID already and their quarantine is over, are you as protected as if they are vaccinated?
So the answer is people who have had COVID commonly develop some immunity to COVID, but it's clearly not as strong as being vaccinated. And so this recommendation today is, even though somebody's had COVID, is to subsequently be vaccinated. Now that may be delayed from the time they've had the COVID. And I've heard things 30 days, 60 days, and even 90 days. But after that, it's reasonable and it's appropriate to get vaccinated at that point. And it really is safer. Somebody who's had COVID, I've seen actually people have a second case of COVID. Unfortunately, the data that and we know there are cases where people are then reinfected with COVID with a little bit different variant from what they had before. But I think there are a few cases even with the same variant, although that data is not as good because earlier on there wasn't so much testing of the specific variants. It's still pretty unusual, but it can happen. And my guess is it'll happen more and more as people with COVID, if they don't get vaccinated, will likely become susceptible. And the other point is there's high variability from person to person about their immunity status after a COVID infection. Some may have really strong immunity, others not so much. And so that's where you get much, much greater variability. It's not close to being vaccinated.
Great, thanks for that clarification. We have a great question from Janet. And I think this is directed to you personally. What kind of mask do you wear?
What do I wear?
What do
Most
you
of
wear?
the time I wear a surgical mask at the hospital. I also have a chili pepper mask that my daughter made for me. That's a cloth mask, but that's really only casually when I'm out socially. At work, I'm required to wear a surgical mask, actually.
All right, thank you for that. We have a great question from Sue, which is, I've been wondering why Parkinson's and other neurological disorders were not included in the list of conditions that allowed people to get vaccinated early. Obviously, this is not a concern anymore. Anyone can get a vaccine whether or not they have any preconditions. But early on, Parkinson's and other neurologic disorders were not on that list. Can you think about what the motivation was for that?
Two things, I would think. Number one, people weren't really certain that Parkinson's alone increased the risk. And two, insufficient lobbying. I think that those are the two factors.
Very good. Now, fortunately, we don't have to worry about any of that. Anyone with Parkinson's or without any conditions at all, if they're 12 and older, can get vaccinated. So that's really fantastic news. We are going to ask one last question, and this is a question that came in during registration. So we talked about being indoors with masks, etc., or without masks if everyone's vaccinated. What about shaking hands and hugging? What are your thoughts on that? Is that a thing of the past?
I thought it was going to be a thing of the past, but I'm seeing it come back. And, you know, there's something about personal connection that's very compelling to all of us. On the other hand, we had a lot less flu and other colds this past year as we all observed these things. And, you know, the most common cause of death in people with Parkinson's is pneumonia. So good hand washing technique is something that we should keep going forever. Shaking hands with people that are vaccinated is probably okay. But you know what? You should probably wash your hands after you do that, before you touch your face and before you eat. That makes sense. So there are some lessons we can learn here that will stand us in good stead, COVID or no COVID.
I
But you
agree.
can't go without a hug.
Yeah, absolutely. It's all a balance. It's all a balance as we ease back in. Well, I want to take this opportunity to thank you so much, Dr. Perlmutter, for doing this on behalf of the APDA community, and for everyone listening and everyone who's going to access this later when it's archived. Is incredibly important information. I think we got to all the questions that people asked during registration and today. So I think we've really addressed a lot of the things that are on people's minds. So thank you very, very much for all that fantastic information. And I want to thank everybody who participated, who asked questions, and who generally come to APDA for information about Parkinson's. Thank you very much for your participation. And I hope everybody has a wonderful rest of the day. So thank you so much, everyone.
Thank you, Rebecca.